DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of Allflex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show. We're down here at Starkville, Mississippi. We're at the Merck Mississippi State Stocker Veterinary Conference here in the Southeast. We have Dr. Chay Trejo, Dr. Buddy Ray. It's going to be a great show. We're going to talk stocker cattle. Thanks for joining us.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and we are here in Starkville, Mississippi, and we're at the Merck Mississippi State Southeast Stocker Veterinary Conference. It has been a two-day event. It has been tremendous. We've had veterinarians from all over the Southeast, and we've been talking a lot of topics, and I got two people here that are just outstanding veterinarians for stocker cattle, Dr. Buddy Ray and Dr. Chay Trejo. And so let's just start out and tell the viewers a little bit about yourself and where you live and your what you're doing.
I'm Dr. Buddy Ray from Mayfield, Kentucky, and we've been in a mixed practice for 44 years, and I've been in the feeder cattle business all my life. We work with clients all over the Southeast that handle from 500 head of calves a year to 15,000 head, and it's an important part in the Southeast because we don't have feeding capacity for the finishing products, so we are the stepping stool to the finishing phase at the feed yard.
Perfect. And Dr. Chay?
Yeah, I'm Chay Trejo. I live in Northwest Florida. Me and my wife try to raise 5 kids in a setting that's stocker-based farm, so we not only do veterinarian work with the stocker operators, but try to start some cattle ourselves. I got my feet wet in the stocker business here in Mississippi, and have really worked with stocker operators for the last 20 years throughout the South.
Yep. And so as we work through this, both of these men are tremendous veterinarians not only in stocker but known nationally, and to get you on the show is a treat for me. Talk to me a little bit about, what we're trying to accomplish in the stocker operation. You alluded to it a little bit.
Well, our normal cow herd in the Southeast is 22 mama cows, so we have to consolidate those calves and make larger groups and get them into operations that can feed them more efficiently and better health quality and all. So it's just a concentrating of the animals that we have into a more productive and better production unit by consolidating them.
So, Chay, when we consolidate them, what are some of the major challenges that you're facing in these stocker operations then, as we kind of lead us into what we're going to discuss today?
Sure. So Buddy mentioned the small cow herd size, and that leads us to have a lot of different locations represented within one group, which creates this stress for the animal, and it's for stocker operators, it's trying to mitigate the stress of the animal to let him perform better. So we try to let that animal go from where he's comfortable and at his place of origin, and we put him in a mixed situation with calves that he doesn't know, and the stocker operator's job is to help him learn that environment and do well and succeed, and that's part of what we try to teach and help people do.
And, as we talk about in veterinary medicine, getting that veterinarian, it's something that Merck has really helped with, but getting that veterinarian integrated with these stocker operators is vital.
That's correct. They have the knowledge and the assistance from nutrition to husbandry to medications, and they'll be used in that whole operation. So the local or the consulting veterinarian that's coming in to assist their production protocols are very essential.
Yep. All right. Well, we're off and running. Great show. Dr. Chay Trejo, Dr. Buddy Ray. I'm Dr. Dan Thompson. We're going to take a break, and we'll be right back after this commercial.
Nasalgen 3 is a new 3-way intranasal BRD vaccine that offers young calves unrivaled protection against devastating respiratory diseases, including IBR, BRSV, and PI3. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose new Nasalgen 3 PMH, the first and only 5-way intranasal vaccine on the market. Talk to your veterinarian and visit nasalgen.com to learn more.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Buddy Ray and Dr. Chay Trejo, and we're discussing stocker operations. And it's kind of the ghost of the, stocker operators are the ghosts of our industry. We have a lot of seed stock people that are out in the public, and we have feedlots that are advertising for customers, and a lot of our stocker operators are tucked back in the country, and it's kind of the lost area of that, and some of these people want it to stay that way. They just seem to be out of the public eye, which is great. But what we're here to talk about is the value a veterinarian can bring to a stocker operator and getting hooked up to improve health.
Right. The veterinarian can be critical from procurement of the animal, getting it bought, getting it handled correctly coming into the operation, making sure that the animals are acclimated to the commingling and all that goes with the cattle coming in. The veterinarian's important part of the protocol of how we're going to vaccinate and medicate and pull and treat any animals that have some adverse reactions or adverse situations, and make that into something that we've got a product that goes to the feed yard from the cow-calf producer that is a quality product that is going to perform when it gets to the final stage of its production.
Absolutely. Chay, what are some of the things when you set up a visit with your stocker operators? What are some of the things that you're trying to do while you're there on the farm?
a lot of the things that Buddy mentioned are key. One aspect that the veterinarian brings as almost a partner to the organization is he has this outside look across many operations, and he can kind of help guide and hold the hands to these stocker operators that the sky's not falling, and and sometimes the operator themselves get in a rut. They can't see the whole big picture, and the veterinarian's there to kind of help guide them through data and guide them through decisions to get them through those tough times.
As you see stocker operators that don't utilize versus ones that do utilize veterinarians, what are some of the bigger differences?
Most all of the larger operations have a veterinarian connected to them from the standpoint of the extra eyes, because multiple units may be being in operations. So if there's a problem from water supply to the feed quality or the nutrition, we're able to go in and have eyes that the farmer or the rancher that is raising those calves, seeing them daily, he'll walk by and miss the problems that are costing him production as well as economically.
Yeah, and Chay, we tend to focus on health, but there's a lot more to it as far as performance as well.
Right. Yeah. And like Buddy says, the day-to-day things we kind of can ignore. The performance aspects, are there windows that we can utilize anthelmintics or growth promotants that we don't capture because we can't see the trees for the forest? And I think the veterinarian's a key part of that.
Yeah, I keep going back to the block and tackle and doing ordinary things extraordinarily well with our crews. It gets mundane at times, but our job is to really help push through those times and bring excitement to a job well done.
That's correct.
All right, we're going to take a break. When we come back, we're going to talk more about stocker cattle health and production and veterinary medicine here with Dr. Buddy Ray and Dr. Chay Trejo. You're watching DocTalk, and we're glad you joined us.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Chay Trejo and Dr. Buddy Ray, and we're talking about stocker operations and stocker health. And so as we stepped away and we had some discussions, really developing those protocols for consistency and compliance so that we can start to sort the other things out that maybe aren't associated with the process on health is important.
Correct.
Mm-hmm. So talk to me a little bit about when you guys are setting up your protocols, what are some of the things that you're focused on?
Well, they all usually are commingled calves with similar problems. So the vaccination protocols usually will cover the viral vaccinations, and the route of administration will be determined by the sources of the calves typically. So they typically all get those. They'll get a Mannheimia and Pastorella vaccination, which covers the bacterial pneumonias most common that we see in background calves. And then we'll also include 7 or 8-way clostridial vaccines as a minimum, and try to cover the typical most problems for BRD.
Yeah, and those seem to be core, right?
Correct.
From AABP and our new recommendations of core vaccination. So I think it's vitally important. What other things are we looking at on the protocol? Chay?
You know, one thing I think I missed the first 15 years of my career is how vital coccidia control is in the high-risk calf. I think I ignored it maybe, and we brought up that stress phenomenon earlier, and that's just subsequent to that. So I think we have to focus to make sure we have some control there on the front and treat if necessary. Coccidia is a parasite, so that brings me to parasite control, and we've struggled in the U.S. With the conversation about resistance and how we handle that. So we have to ensure that we have protocols to cover those calves when they come in.
Yeah, it's, that's what going through the 2 days, and folks, if if you're a veterinarian out there watching, this is a conference I highly recommend you attend. But the at Mississippi State Southeast Stalker Vet Conference, sponsored by Merck. But the thing is that as we go through the anthelmintics and that, we're still learning.
Oh, absolutely.
Yeah. This is not an open and shut case. And so by working with your veterinarian and the veterinarian going to these types of meetings, this has just been remarkable. Every talk I've picked up something new or something that I'd ignored.
Correct. And the veterinarian for the different operations, he may handle your operation different than your neighbors because you may have different sources. So he's going to the veterinarian gives you the opportunity to have a fine tuning, if you would, of your protocols. And that just improves the stalker efficiency and improves their outcome.
Yep. And, Chay, do you use data then with your operations?
Sure, and that's something I think the stalker operator in general can struggle with, and there's the extra value of a veterinarian on place is to be able to keep that data and manage it and make suggestions off of it that a lot of times stalker operators just don't have the time and the day to do.
Yeah, I find that with all segments, and it's one of those things is that the only way to change the outcome is to change that process.
Correct.
Yeah. And we won't change our process if we don't know that we're having a negative or positive outcome.
Correct.
Yeah, I think the question we get is what's working or what's not, and they immediately want to change a protocol or change a drug, and without data and the veterinarian's advice, it's just
hard to come to a logical conclusion.
I'll leave us on this segment with my dad used to say it was easier to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars. And so if you want to make some changes for really good outcomes, you got to have the veterinarian to help get the right diagnosis. Correct. So we're going to take a break. When we come back, more here on DocTalk from Starkville, Mississippi.
We see you, working hard from the early mornings to the late nights and every hour in between. We see you. We see the pursuit, the desire, the effort, the hope, the goal of being a champion. And we see that you need a partner to keep your animals healthy and happy. With our countless products and quick and reliable shipping, together, we can do just that. To the cowboys and cowgirls, to the dreamers, we see you.
We are a start-to-finish yard, bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from a few different companies here and there, but we started working with Bimeda. What I like about working with Bimeda is our rep. He seems like he's just one of us. He knows he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Macrocin last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a first poll treatment. So what really jumped out to us working with by META meeting with the rep, Mackerson's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on, but when you've got a product like a Mackerson, it's just another assurance protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these META products, they're proving that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here in Starkville, Mississippi at the Merck Mississippi State University Southeast Stalker Veterinary Conference, which has been a 2-day event. Just been phenomenal. Got 2 unbelievable veterinarians here, Dr. Buddy Ray, Dr. Chay Trejo, and you know, I always try to do something here because I know we have stalker operators that are watching and stalker vets, and so as I always try to say, okay, now if I'm sitting out there watching, if you're going to walk on the place, what are things that are, you know, top of the list that we're going to cover first and discuss?
First thing I'm going to ask is what is the origin and the procurement protocol for the animals that are getting, and whether they're pre-sold, if they've got a marketing plan for where they're going and how large they're taking them, and how many of their flow of animals are, how many are you putting in every week. The second thing is, what kind of feeding system do you have? Do you stay on a consistent feed? Do you buy a commercial feed? Do you make your own feed? Do you buy and feed anything? And then the final thing would be how you would medicate and be treating and pulling the sick animals.
Identification.
Identification.
Yeah. Jay?
Yeah, I go down a similar path. Systems thinking is important on a stalker operation. You know, the quote that there aren't solutions, there are trade-offs. And so when we make a management change or a drug change, what kind of impacts are they going to have? How do we manage our sick cattle? I think that's a key importance, and how clean a place is. And you know, the small details are really important on a stalker operation, and we just have to kind of point those out.
Yeah, it's a tremendous opportunity, you know, both from an animal health standpoint. It's so important to our industry, this stalker and backgrounder, and it's so important to use these natural resources that we have in this part of the country, and part of those natural resources are the people, right?
Yep.
And I've yet to meet a cow or a dog that's picked its vet, and and so when we talk about that, talk a little bit about, you know, some of the people aspects.
Obviously, these are people that we've been in business with for years, and the relationships that you have with them are personal as well as economical, because you want them to be successful. So again, we're in animal agriculture. There's no better place, no better thing to do than caring for the creatures God has given us opportunity to take care of. And I look at the stalker animal operators, or those people that are taking care of those animals at that age of their production.
Yep, I couldn't agree more. Jay?
Yeah, and the veterinarian just adds to that relationship. If the stalker operator is not successful, he's not successful. So I think, and you can say the same thing with a healthy calf, right? We want those cattle to be healthy, and if they're not healthy, they don't perform, and we're not economically viable. So to have that sustainable relationship, the veterinarian's critical.
Yeah. Well, gentlemen, I want to thank you for taking time out. You're both extremely busy, and appreciate it.
Thank you.
Thank you, Dan.
Folks, I want to thank you for watching Doc Talk. Remember, if you want to learn more about what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. With Dr. Chay Trejo and Dr. Buddy Ray here in Starkville, Mississippi, I'm Dr. Dan Thompson, and I'll see you down the road.
Doc Talk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.